The warning is easy to miss. You start Zepbound, Tirzepatide, or Mounjaro, Tirzepatide, and keep taking the same birth control pill. The real problem is not the weekly shot alone. It is a 4-week window when the pill may work less reliably. Many people never realize the risk is tied to that short timing window, not to the whole year of treatment. That window is not random. It matters after the first dose, and it matters again after every dose increase. So this is not only a day one issue, it can come back during dose increases, right when people begin to relax because the medication already feels familiar. Many people get this wrong in one of two ways. They assume the risk lasts forever, or they assume it only matters if they are vomiting. The label describes a narrower pattern than that. These drugs slow stomach emptying. That is why a birth control pill can become less reliable during specific timing windows. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Here is the mechanism in plain English. These drugs slow how fast your stomach empties. That helps reduce appetite and improve blood sugar. But it can also change how an oral medication moves through the gut and gets absorbed. That is why the warning focuses on birth control pills, not every kind of contraception. A patch, ring, implant, shot, or IUD does not depend on stomach absorption in the same way. For pill users, the advice is to switch to a non-oral method. Another option is to add a barrier method for 4 weeks after starting. The same advice applies for 4 weeks after each dose increase. The strongest slowing effect happens early, then tends to ease over time. Later on, people can start treating the medication like background noise. That false sense of normal is part of the problem. A calm week does not prove the timing risk is gone. Timing is only part of the risk. In some people, fertility can also change during weight loss. Cycles may become more regular, and ovulation, meaning the release of an egg, may return more predictably. That matters most in people whose cycles were less regular before treatment. So the problem is not one dramatic change, it is two smaller changes that can overlap. Pill absorption may be less dependable during the 4-week window. At the same time, some people may become more fertile than they were before. That combination is why a casual approach can fail. That overlap becomes dangerous when people judge risk by drama instead of timing. Some viewers expect the main danger to be a rare medical emergency. In real life, the bigger problem is often ordinary behavior. The pill stays the same, the routine stays the same, and the date of the dose increase is forgotten. Nothing feels dramatic, so the backup plan quietly disappears. People on a stable dose are one group. People who are starting Tirzepatide or moving up the dose while relying on a pill are the higher risk group. That is where this warning matters most. Symptoms do not reliably protect you here. Some people think, if I do not feel nauseated, my pill must still be working the same way. That is not how the label warning works. The issue is delayed stomach emptying itself, and that can matter even during a week that feels normal. Vomiting or severe diarrhea deserves even more caution. Those symptoms are not the whole reason for the warning, but they add another reason not to trust pill reliability during this period. A pill that is already in a vulnerable window is not where you want to guess. Missing pills can also make a bad window worse. Travel, nausea, appetite changes, or routine disruption can make someone take pills late or miss them. During a 4-week backup window, that ordinary mistake matters more. A small routine slip can stack on top of the timing problem. The highest risk situations are practical, not mysterious. Starting Tirzepatide while staying on the pill with no backup plan. Increasing the dose and forgetting that the 4-week clock starts again. Missing pills or having major stomach symptoms during that same period. Those are the situations where assumptions become risky. If that window was missed and unprotected sex already happened, contact a clinician promptly. Ask for guidance based on your dates and method. That is the moment to act quickly because protection may already have been affected. Do not just hope the timing was fine. Waiting until a missed period means acting late when fewer options may remain. If you use a birth control pill, make the backup plan before the first injection. Then revisit that plan before every dose increase. Ask your prescriber which backup method makes sense during the first 4 weeks. That may mean condoms, another barrier method, or a switch to a non-oral method. That plan needs to be written down. A weekly shot and a daily pill do not create the same habit. A weekly treatment feels like one event to track, while birth control reliability depends on many ordinary days. That is why the backup method and the dates need to live in the same plan. To avoid losing track of the daily pill, put the backup method on your injection calendar. Use the same calendar for dose changes. Add the start and stop dates there too. Do not let the weekly shot get all the attention. Mark the first injection date. Mark every dose increase date. Count forward 4 weeks each time. If you rely on a pill and cannot remember the dates, the backup window becomes too easy to miss. Phone reminders can strengthen this tracking system, especially at dose change points. A dose increase can feel like a simple refill or step up. It may not feel like a new time when backup birth control matters, but the backup clock restarts and a reminder can catch that moment before it is missed. Longer-term prevention gets much simpler when you focus on dates and backup methods, not just symptoms. If a non-oral method fits your situation, it avoids the stomach absorption issue. That issue is what triggered the warning in the first place. For some people, that is easier than repeating backup windows across several dose increases. You may already expect the dose to go up over the next few months. Build that into the contraception plan now. Do not treat each increase like a surprise. A repeating schedule needs a repeating protection strategy. Coordination matters too. One clinician may manage weight treatment while another manages contraception. That is exactly how this warning gets lost between visits. That gap is common in real care. Bring both topics up yourself because the risk comes from the overlap, not from either issue alone. The bottom line is simple. On Zepbound or Mounjaro, this is mainly a birth control pill issue and mainly a timing issue. The 4-week window after starting and after each dose increase is the part many people miss. Know those dates, use real backup if needed, and you can prevent a problem instead of discovering it late. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.